Thank you. Hi, everyone. My name is Jessica. I am going to be your MC for this evening. I am a white 30-something year old woman with long brown hair, and I'm wearing a black shirt, and I am in a soundproof Zoom room, whatever that means. Welcome to tonight's Rtag general membership meeting. We have a jam-packed agenda for you all tonight. And without further ado, we're going to go ahead and get started. We have Asl Interpreters for today's meeting. Our Asl Interpreters are Katie McFarlane and Tom Lauterbaran. I'm sorry, Tom, I don't think I said your name correctly. To view their video, you find the interpreter's video in the gallery. Then in the top right corner of the interpreter's video, you can click the ellipses, and then you click the pin video option. This will keep the interpreter's video on your screen. You can also hit speaker view, where the speakers will be spotlit. Next slide, please. We also have cart captioning for tonight's meeting. Our cart captioner tonight is Denise Gracia. To start viewing closed captioning, you can click the closed caption button with the CC icon. One tip is to click and drag the closed captioning to move its positioning in the meeting window. To adjust the caption size, you can click the upward arrow next to the stop video button. Click video settings, then accessibility. Then you can move the slider to adjust the caption size. Next slide, please. Please use the chat for any technical questions. If you have a technical question about Zoom or the features of this meeting, please use the chat function. Our technical assistant will attempt to troubleshoot your problem and get back to you. Next slide, please. As I said, we have a very packed agenda for you all this evening. We'll start with the welcome and Zoom instructions, which we just went over. Next, we'll hear a co-chair update from Elizabeth Foster. Then we'll hear some updates from SWA from Laura Brelsford, Assistant General Manager. Then we will hear presentations from the Bus Network Redesign crew featuring Doug Johnson, the Bus Network Redesign Project Manager. Then we will hear some accessibility updates to Forest Hills from Arthur Gillis from the Capital Delivery Project Manager. Then we will have a portion dedicated to feedback for SWA. Then we will hear from the ride from Michelle Styler, the Chief of Paratransit Services. And then we'll have a questions and feedback session for the ride. Then we'll have the closing remarks. Next slide, please. Next, we're going to hear from Elizabeth Foster for our co-chair update.
Good evening, everyone, and welcome to our June Riders Transportation Access Group General Membership Meeting. I'm Elizabeth Foster. I am a white woman with brownish red hair, and I'm wearing a black blouse, and behind me you can see a purple curtain in my room. And my lighting is very terrible, so sorry about that. I am the co-chair of Rtag's executive board, and in case we have any new folks who are joining us this evening, Rtag is an independent consumer-driven board that advises the MBTA on matters that impact seniors and folks with disabilities, advocating for a public transit system that is accessible and equitable for all riders. Our advocacy and organizing work is led by our executive board members, which consists of individual members Jerry Boyd, Joanne Daniels-Feingold, Tom Gilbert, Elizabeth Dean-Clower, and myself. And then we have organizational members who are Kathy Paul from Mass Senior Action Council, Diana Hu from the Boston Center for Independent Living, Nora Nagel from Bay State Council of the Blind, and Cassandra Xavier from Disability Policy Consortium. Since our last general membership meeting, we have partnered closely with the plaintiffs from the Daniels-Feingold versus MBTA settlement on fixed route advocacy initiatives, including providing feedback and comments for the Transit Ambassadors accessibility training. And we are currently collaborating on drafting comments on the bus network redesign initiative that you will all hear a presentation on later in this meeting. Our RIDE subcommittee has continued to collaborate closely with the Office for Transportation Access to address the RIDE software transition and more general systemic issues. And last month, as a follow-up to our emergency meeting last fall, we held a listening session to hear from the public about how the RIDE service has been operating for the 6 months after the transition. Thank you so much to everyone here who attended, provided feedback, and shared your improvements and concerns. And thank you all again for being here tonight. And now I'm going to turn it back to Jessica to introduce our presentations.
Thanks, Elizabeth. Without further ado, I'm going to turn it over to our presentations from the MBTA. First up, we have Laura Bralsford from the Department of System-Wide Accessibility.
Thanks, Jessica. Good evening, everybody. I am Laura Brelsford from the Department of System-Wide Accessibility. Really, my role tonight is simply to introduce two of my colleagues who will be talking about two really important and exciting initiatives happening within our fixed route system. Before I turn it over to them, though, I just did want to remind everybody here that there are a lot of initiatives related to improving accessibility happening at the T every day. And for our full, most recently updated report, you can go to our website at mbta.com/accessibility. And as we always like to note, if you are out on the system and want to share feedback with us, whether that's good or bad, we really do want to hear from you. So if you have any questions, complaints, or commendations, please let us know. You can do this in a few different ways. First, by calling our main customer support call center at 617-222-3200. You can also fill out a comment form on our website, mbta.com, and click on the support link. Or you can always tweet at us at MBTA. If your comment or question is related to accessibility on the fixed route, my team will get copied on it and we'll work to make sure that it is responded to and investigated appropriately. All right, with that, I have the pleasure of introducing Doug Johnson from our Bus Network Redesign team, who's going to be talking a little bit about what Bus Network Redesign is and how you can get involved. Doug?
Thank you very much, Laura. I am just going to share my screen so that folks will be able to see the presentation. Can I get a confirmation from folks that they can see what I'm sharing? Yes, okay, great, thank you. As Laura mentioned, my name is Doug Johnson and I am the project manager for Bus Network Redesign. I'm fairly new to the role as of this week. So this is one of my first presentations on this, but there's a wonderful team of people who have been working on this for a couple of years. I'll just describe myself visually. I'm a 30-something white male with short brown hair and a beard sitting in a room that is repurposed into a home office as best as I could. I'm also joined by my colleague, Melissa DeLay, who's the Director of Service Planning. Melissa, I hope we got your title right, at the MBTA. And we'll be able to answer any questions that anybody has about Bus Network Redesign. Many of you may already be familiar with this project, as it has been underway for some time, and we've been conducting extensive public outreach related to it over the past few months. But Bus Network Redesign is a complete reimagining of the MBTA bus network. It took a blank slate look at travel in the Boston area, how folks were getting around by all modes of transportation, not just on buses or rapid transit, but by driving, by walking, by biking. And then it looked at how to redesign the bus network to better meet the way people are currently getting around Boston, where they're going to, where they're coming from. And part of the reason why we took this approach is because in the last couple decades, new employment centers have emerged that didn't exist, 50 years or more ago. There's new housing in places where, in areas that were formerly industrial or commercial. So land use patterns in the Boston area have changed a lot, especially recently in the last couple decades. But the bus network has not changed very much. In some cases, bus routes haven't changed in 100 years. So it's not as responsive to the needs of people in the Boston area as we'd like it to be. So the purpose of this study is to realign the bus network to better serve people's needs. The Bus Network Redesign project is being coordinated with other major initiatives at the MBTA. And on this slide, you can see there's a sort of circular flow chart that is meant to describe the relationship between the Bus Network Redesign and other initiatives at the T. So in addition to looking at redesigning the bus network, the MBTA is also in the process of modernizing the bus fleet and our bus maintenance facilities. So that's a process that's underway that's looking at redesigning all of our bus garages over a span of many years and eventually replacing the entire bus fleet with new buses. So we are coordinating with that effort to understand what the fleet capabilities will be in the future, what kind of buses we'll have, what their capabilities will be. And we're also coordinating with the Bus Priority Initiative at the MBTA. And this is an effort to implement more things like bus lanes, transit signal priority, and other types of infrastructure on city streets that improve reliability of bus service and really allow buses to maintain the schedules that we want them to maintain without getting bogged down by traffic congestion. Bus Network Redesign really it had a precursor project called Better Bus Project, which took place over a couple of years, or over the last couple of years. And there was an extensive amount of public outreach in the Better Bus Project that has continued through Bus Network Redesign. So through both the Better Bus Project and the public outreach that we've done for Bus Network Redesign, we've heard some key themes from bus riders and other folks in the region that they want transit service that goes where they want to go and when they want to go there. They want a network that is simple to use and easy to understand, is fast, frequent, and reliable, and a network that serves the people who are most dependent upon it. So as you may know, if you use the existing bus network, the times that buses run, the time of day, how frequent it is, doesn't always match up with when the highest demand exists for that service. So a big part of this process is about realigning the bus network so that there is service when people really need it most, and that it's running at the times of day when people need it. To the point about serving the people who are most dependent upon it, we know that demographics have changed in the Boston area, and we want the bus network to be responsive to the needs of the folks who are going to need it most, in the sense that they may not have access to other forms of transportation, or they, for various reasons, may have a higher propensity for the need to use public transportation. So to that point, we created a list of principles to guide the process of redesigning the bus network. And really the first is that we wanted to lead with equity. We wanted to take an approach that would prioritize folks in the Boston area who are of low income, people of color, seniors, people with disabilities, or people who live in households with few or no vehicles. So by focusing on folks in those demographic groups, we would know, or by aligning service to serve those folks as best we could, that would ensure that the bus network was serving people who may be the most dependent upon public transportation. We also wanted to have more frequent service in neighborhoods where lots of people were making trips, where folks, where folks live, where folks work. We wanted to increase frequency to match the demand for travel to and from neighborhoods. We also wanted more all-day service, so less focus on the morning peak and the evening peak, and more focus on having frequent service all day, because we know that that serves folks who have lots of different types of jobs or maybe need to travel for reasons that aren't work related, of course. We also wanted to create new connections to places that currently exist and places that didn't exist a few decades ago in the sense that they exist now. So a good example of that is the Kendall Square area, which 50 or 60 years ago didn't have the number of jobs that it has today. So we wanted to realign the bus network to better serve some of those job centers that emerged in the last few decades, but didn't have the level of transit service that was warranted. And then finally, we wanted to make the network simpler and easier to use. Anyone on this call who has used the bus network will know that there are, for some routes, there are different variants and different routings depending on the time of day or what day of the week. Sometimes frequency changes as well, depending on the time of day. And changes like that can make the system difficult for folks to navigate and to understand. So we wanted to make it simpler for folks to use by sort of reducing the number of variants that exist and having the network be more consistent. We had some particular considerations related to accessibility, including the distance required to walk to a stop. So one of the things that you have to consider when planning for transit service is that there's basically two approaches you can take, or sort of a middle ground that you can take. One is, and this is in a situation where you have a fixed number of buses. You can decide that you want to serve the broadest area possible with these buses that you have, but that may mean that the routes you have aren't particularly frequent. Or you can decide that you're going to reduce the coverage or ask folks to walk a little bit further to their routes in order to put more buses on those routes and therefore have more frequent service. So coverage and frequency sort of always exist in tension with one another as like two sides of a scale, and we try to find the right balance between those. So with this first example of distance required to walk to a stop, in some cases, when we look at the new bus routes that we're proposing, some folks may have to walk a little bit further or travel a little bit further from their home or their work than they used to get to their bus stop. But the benefit of the way we set up the new routes is that the bus service should be much more frequent. So there'll be some cases in which you no longer have to worry about checking a schedule because the bus service is so frequent all day that you know that if you just show up to the bus stop, that the bus is going to show up relatively quickly. So that is a trade-off that we've looked at in many cases, and it's something that we are continuing to evaluate because we know that for lots of folks, the distance that's required to travel to a stop is how much of a burden that is on them or a hindrance is going to vary depending on their particular situation. So how much of a burden that is not going to be the same for everybody. And this is something that we want to keep in mind because we don't want to create a particular hardship for folks by looking at the system this way. Also tied into that is the number of transfers that would be required to make a trip. So by looking at more frequent routes, to some extent, we may be asking folks to make a transfer where they had a one-seat ride before. But if you can have 2 routes of really good frequency, then the transfer should be pretty seamless between those 2 services. So that's something that we're looking at, sort of what the transfers would be in places where folks used to have a one-seat ride, but maybe a pretty infrequent service. Crowding is obviously something that we're looking at as well. And our hope is that by increasing frequency on a lot of these routes, we'll be able to decrease crowding. Of course, we're also looking at accessible bus stops. So as right now, we're working to finalize the new network map, but the implementation of that network is expected to take from 1 to 5 years. We're anticipating it would take up to 5 years and be phased over that period. And part of that implementation is going to be identifying stop locations and figuring out where stops need to be made accessible, where there already are stops that are accessible that can continue to be served, and where we may need new stops, of course, that would then also have to be accessible. So that's a key consideration in this process and something that's going to be looked at continuously through the implementation of the bus network redesign. And then the last point is proximity to important destinations, such as shopping centers, healthcare facilities, senior housing, et cetera. So we're not just looking at what trips people are making and how they're traveling around. We're also looking at where senior housing exists, where hospitals are, or other healthcare providers that folks need to get to, and other major destinations, so that we can make sure that we serve those locations with good enough frequency that folks will be able to get to them reliably, conveniently, and quickly. We have created a draft map, and that is available for public input right now. I'll talk in later slides about how you can provide input on that map, but we have done some analysis of that map to see how it compares to the existing bus network. And what we found is that in the map that we have proposed, 275,000 more people would have or would be near to a high frequency service. That's a service that's running every 15 minutes or better all day. That's 275,000 people over the existing network. There's 150,000 more people of color would gain access to high frequency service, and 40,000 low-income households would gain access to high frequency service. We're proposing a 25% increase in bus service across the board, and that increase in service is really what allows us to propose the number of high frequency routes that we're proposing, which I'll show you in a second. We're also proposing a 70% increase in weekend service. And just as an example of how we're thinking about those major employment centers, right now, the Longwood Medical Area is a place that has transit service, but it's not particularly reliable, and it isn't particularly frequent. And so we're looking to address that in this new map. And what we've proposed, we found that 200,000 more people would gain access to frequent service to the Longwood Medical Area. There are 2 maps on this slide that I'll talk about. The map on the left shows, it's a transit map, so geography is distorted in order to highlight the transit routes and the connections that they make. But in this map, you can see there are blue lines that represent the existing high frequency bus services. So you can see that there's only 15 of them, and there are large areas within the region that are not served by high frequent bus routes at all today. The map on the right, the sort of geography, the way that it's represented is the same for comparison. And you can see that there are now 30 high frequency routes. And you can see that we have sort of filled in the areas that do not have high frequency routes today. And we've also realigned some of the existing high frequency routes. So these maps depict that increase of 15 high frequency routes to 30 in the proposed map. As I mentioned earlier, under this proposal, 275,000 more residents would gain access to bus service that is 15 minutes or more frequent all day, 7 days a week. Right now, only 27% of weekday service meets that threshold for frequency. But in this plan, it would be 50% of weekday service. So communities like Everett, Lynn, Medford, Somerville, South Boston, and West Roxbury, which currently do not have all-day high-frequency service, would gain high-frequency service all day under this proposal. And in a place like Longwood Medical Area, where there are only 2 frequent routes today, there would be 6. So we are also focusing on frequent bus service on corridors and connections that are not served by rapid transit. So this is to some extent about aligning the bus network so that it better complements and coordinates with the existing rapid transit network. Just some other examples of the benefits of the proposed network. I mentioned the benefits to the Longwood folks accessing the Longwood Medical Area. Approximately 180,000 residents in the MBTA service area would gain access with high frequency service to the South Boston waterfront. 50,000 more residents would gain access with high frequency service to the Back Bay, and approximately 58,000 residents would gain access with high frequency service to Kendall Square. This map depicts our project timeline, and there are columns for basically each season and the phases that correspond to those seasons. Right now, we are in summer of 2022. We have released the draft network map and are collecting input on it. This fall, we intend to make changes to the map based on all of the feedback we get from folks, and then finalize the map, so to speak, do additional analysis on that map to see what the benefits of that final proposal would be, do additional outreach after that to talk to folks about those changes, and then begin implementing that new map in 2023. And as I mentioned, we expect it to take approximately 5 years to fully implement this map. We have been conducting probably a larger public outreach effort than any other project that the MBTA has undertaken, at least in the last few years. We have an online feedback forum. We've been conducting focus groups with different community partners. We have an external task force meeting that has met several times. We've been meeting with municipalities and other agencies to discuss the map. We've had staff from the MBTA, we're calling them street teams. They go out into the public, sometimes around transit stations, sometimes at other locations, to inform folks about this process and tell them about how they can get involved. We've also had open houses at stations where we've directly collected feedback from folks. And of course, we're also engaging with all of our bus operators and folks who really run the system and keep it going. And of course, we're meeting with elected officials as well and advertising in transit stations, on the radio in different languages, on billboards throughout the Boston region and other places as well. There is still a lot of public outreach and engagement activities taking place right now that you can participate in. We've had a number of virtual community meetings held on Zoom, like this meeting, that started in May with they're based on geographic areas. So we've had a meeting for the whole system, South Shore and the suburbs south of Boston, a meeting specific to Boston, Mystic River and North Shore, a meeting for the inner core communities, and then we just had a meeting for the Minuteman and Metro North area, and on Tuesday we had a meeting for the Metro West area. On July 19th, we're going to have an in-person open house at the Bowling Municipal Building in Nubian Square. And then on July 26th, we're going to have a virtual public hearing, followed by on July 28th, an in-person public hearing at MassDOT and MBTA headquarters at 10 Park Plaza in downtown Boston. We also have some station open houses happening in July. On July 7th, there'll be one at Sullivan Station. On July 12th, there'll be one at Forest Hills. And on July 21st, there'll be one at Wonderland. We may end up scheduling additional open houses, but we're still working on finalizing that schedule. And we have some additional street team engagement activities coming up. On July 6th, we'll be in Nubian Square. On July 11th, Maverick Station. July 14th, Oak Grove Station. July 20th, Ruggles, and July 27th at Wonderland. If you would like to provide feedback or learn more about the bus network redesign, there are a few different ways that you can do so. You can go to the project webpage that we're using for soliciting feedback. The URL is mbta.com/BNRD feedback. BNRD is the acronym for Bus Network Redesign. You can also find the list of events that I just went through on that website. You can also email comments to us at betterbusproject@mbta.com. You can mail us written comments. They would be addressed to 10 Park Plaza, Suite 3830, Boston, Mass. 02116. Or we set up a voicemail line where you can call in and leave your comments by voicemail. And that number is 617-222-3011. If you go to the project website, we've created booklets for every single neighborhood where we're proposing changes to bus service. You can go to the project website, and those booklets are on there as PDFs. They're accessible documents, and they walk through all of the proposed changes in an area. They talk about what the network looks like today and what we're proposing it to look like in the future. And then at the end of those booklets are tables that list every route and describe what the proposed changes are to each of those routes. So if you'd like to, if you're wondering what exactly is proposed for a route that you take, you can find it in the neighborhood booklet, and then you'll see the maps there and the table which has the description of the change. If you have comments related to things outside of bus network redesign, of course, you can always email publicengagement@mbta.com. And that is the end of my presentation. I tried to speak slowly for the sake of the Asl interpreters. I hope that I did right by them.
Doug, thank you so much. And again, Doug and Melissa will be on hand to hear feedback and answer questions in a few minutes. So next up, I'm going to turn things over to Arthur Kellis, who is the project manager for a major station accessibility update that is currently under design at Forest Hills. Arthur, I am going to ask you to do us a favor and keep this somewhat high level, about 6-7 minutes, so we can get right to the Q&A. Thanks, guys.
Arthur, I'm sorry, you're muted.
All right. Am I unmuted now?
You're all set. Go ahead.
All right, great. Hi, everyone. Again, my name's Arthur Gillis. And Laura, thank you for introducing me. So I'm the PM for the Forest Hills Improvements Project. We're underway on design. We're approaching the 75% design. And the slide you're looking at now is an overview of the station. You can look at the picture here, and on the lower portion of the picture, you can see the upper busway that was built back in 2019. Just below that, you have the Forest Hills parking lot. To the right, you have the zip car location. Dead center in the middle is the Forest Hills station. That has both the orange line, lower busway, as well as the commuter rail platform that services the Needham rail. You've got a blue bike section to the left, and towards the top of the picture, you get the Northwest Head House, as well as the Southwest Corridor Park. We can move on to the next slide. So the existing station was built in 1987 as part of the Southwest Corridor project. In 2018, there was a Casey Arboway project that spurred the need for full station accessibility upgrades. What that entails is numerous small upgrades, but the bigger ones, 4 existing elevators, 4 existing escalators. 3 of the existing elevators will be upgraded, and all 4 existing escalators will be upgraded as well. One of the big problems we have at the station, there's no direct connection between the lower and upper busways. We'll be adding something there. You can move on to the next slide. So some of the existing conditions we have on the station. Left picture, you'll see that's the commuter rail platform. And as you can see, there's yellow paint for the edge, not tactile strip. We'll be replacing that, putting tactile strip in. The middle picture is one of the existing elevators that we'll be replacing. There's a total of 3 within the station that we'll be upgrading. Picture off to the right is one of the escalators we'll be replacing. And can move on to the next picture. Some existing conditions still. This is the stair tower or staircase that heads down from the Arborway to the lower busway. The granite, it's been there a long time. A lot of the blocks are displaced, so we're removing and resetting them to give a more even walk surface. The middle picture shows the lower busway. There's a lot of trip and fall hazards throughout this area. We'll be repairing all of them, tearing up all of the brick paver and replacing it with concrete. Exterior, the next picture is the exterior of the station. This is just a picture showing some of the degradation of the station over the years. There's a lot of paint failing. There's leaks throughout the station that we'll be correcting. Next picture. All right, so this picture is again existing conditions. This shows one of the entryways. That's the doors. They have uneven thresholds. We'll be repairing that, replacing the doors, and we're looking at roll-up doors for better access during more temperate weather. Leave it open so people can come in and out. And again, we're fixing trip and fall hazards throughout the station. Lower picture is just an overview of the station, just to give you an idea of what the station looks like. Again, there's trip and fall hazards throughout the station that we're repairing. You can go on to the next picture. So this is the picture we were talking about. I was talking about earlier. This is the connection between the lower and upper busway. This is one of the highlights of the project. We're going to be adding a new elevator and a new stair tower, and it's basically, if you remember the earlier picture, it's to the I guess it would be the southeast corner of the station between the lower busway and the parking lot. And this elevator will give accessibility from the lower busway to the upper busway. So right now, if you go from the lower busway to the upper busway, you have about a 450-foot walk. By adding this elevator and staircase, it'll be reducing the distance to about 125 feet. So this is a nice upgrade to the station. And then we move on to the next picture. Another big upgrade to the station is direct exit from the commuter rail platform. Currently, there's only one mean of egress from this platform, and that's directly into the station. It's addressed by a large stair tower and a small elevator. This ramp will exit heading north and then exit out into the Southwest Corridor Park. It'll start right around mid-platform and slope up and cross over the orange line and the Needham rail and dump out right into the Southwest Corridor Park. We'll have signage at the end that'll direct people back to the station, or it'll direct people more to the north to get out to another accessible location. Next slide. So project timeline, right now, we're between 30% and 75% design. We expect our 75% towards the end of the summer. From there, we'll roll into 100% design. We expect right around the first of the year, and hopefully go out for construction bid sometime late fall, early summer. We expect the project to last about 30 months in construction, and that's pretty much it. Public engagement, we've been involved. We've had people out there from the consultant. They've done a lot of public meetings, public engagement directly at the station. We've had flyers out. We've sent out mailers to people within a half-mile radius of the station. We've put ads in local newspapers. We've had digital ad space on the Orange Line and commuter rail, as well as cards in all of the Orange Line trains. We've had our public meeting at 30%, and we held another interim meeting back on June 9th.
Arthur, thank you so much.
Okay.
Jess, I'm going to turn it back over to you to facilitate the Q&A.
Thanks, Laura. All right. So now we're gonna begin the feedback session for our SWA system-wide accessibility presentations. So if you have a comment or question, please use the Zoom's raise hand feature located at the bottom of your screen. When you raise your hand, it alerts me that you'd like to speak, and then we will unmute attendees to ask their questions in the order that they raise their hands. To raise your hand, you can also do so by pressing Alt-Y on your keyboard or *9 on the phone. So first up, it looks like we have Rhoda Gibson.
Hi, this is Rhoda Gibson.
Rhoda, can you just wait 1 second to be spotlit?
Okay, I'll turn my video on. Oops. Oh, shoot.
Thanks, Rhoda. Go ahead.
Hi. First off, I'm still haven't been gotten back to over the last year since January. I've been asking, why can't Mass Adapt be an organization member on the board? It would not necessarily be me, but it would be someone from Mass Adapt, and haven't gotten an answer back to that. Also, with the recent issues with the orange and green line, and the fact that hasn't been addressed. I know that I've heard on the news that it has been fixed, the issue between North Station and Back Bay. However, is the shuttle buses still going to happen between July? From my understanding, previously it was July 1st to August 1st that there would be shuttle buses from Wellington to Oak Grove. When will that happen? And if it is still happening, is it possible to make all of the buses accessible versus just, one or two here? Normally, in the past, when the shuttle buses have been around going from Sullivan to Oak Grove or wherever, I've had to wait for another bus because the buses that was using for shuttle buses are not always accessible. Are you working on that issue? And, you know, I don't want to have to take 3 hours to get from Wellington to Malden. And I had put that in the chat, but that wasn't answered yet. So those are the two issues. I'm just really upset with the Rtag committee because it doesn't seem to work with everyone. It's only certain people that you guys are working with or allowing on your board. And when the shuttle bus issues come up, I have never really gotten a satisfactory answer. And I should not have to, as a regular, you know, being treated equally, I should not have to get to a station and have whoever, whatever inspectors is guiding, working with the shuttle buses, have to wait for another bus to be called so that I can get out, or being told to go back, take a bus from Wellington, a regular bus from Wellington to get to Malden, which is going to take me another half hour or so to get home.
Thanks, Rhoda. I'll let Laura talk to the SWA question. And I know you and I did connect after the last meeting, but I'm happy to talk to you again.
Okay,
after
well,
this meeting.
we actually didn't connect because the times you were available were not the times that I was available and so forth. But yes.
But you have my number and you can give me a call. I did reach out to you though.
Okay.
So yeah, please call me and I'll call you.
Okay. But as far as the shuttle buses, what's
Shuttle
happening?
buses.
Let me take the shuttle question, because those are that's a very good and very timely question. So there were a couple pieces to it. First of all, the diversion that occurred recently around the government center garage has been resolved, and the service on the orange and blue line, orange and green line there, has returned to regular service. We are tentatively planning some weekend diversions in August on the orange line around the government center station to Back Bay, in order to allow for some additional work to happen there at the garage that, to my knowledge, has not been completely finalized yet. It's not yet up on our service alerts, but when it is, it will be up there on our website. In terms of the diversion between Oak Grove and Wellington, that is currently in effect. So what that means is we are running shuttles starting at 8:45 p.m. through the close of service. That's when the shuttle buses are in effect. And that diversion, I believe, is actually scheduled through basically through the bulk of the summer through August. And that work is critical. Ending service, subway service at that time is critical to allow for some construction activities at the Wellington yard there. Give them some extra time to do that work. Your feedback about the accessible buses though.
Right. Well, before, my main question is, at first, I think it was back in May when the information went out that due to work on the tracks between Wellington and Oak Grove, the shuttle buses would be running.
Oh, the globes on there.
All the time. On the whole time. However, it's not, the shuttle buses for between Wellington and Oak Grove, is that 24 hours a day until the end of August or September? No.
So it will be every day starting at 8:45 p.m. So the orange line service will be doing its thing all day, and then it will stop early.
Okay.
To allow them some extra time in the evening and overnight to do that work. So be less disruptive than what you experienced before.
So that has been changed from what it was stated a few months ago.
Okay, and you can always find the latest on our website. I just took a look in that to confirm that was what's there. But I think to your, in some ways, broader question around the accessibility of our buses. So just want to be really clear that anytime we operate a shuttle, whether we use our own MBTA buses and operators, or whether because of the volume of work, we need to contract with a private carrier like Yankee or Peter Pan, we use every single bus in use is a wheelchair accessible bus. What the big asterisk there is that a number of the private carrier groups that we leverage, they employ a number of high floor buses with lifts in the back instead of ramps in the front, like most of our riders are used to. There are very clear penalties and protocols in place for if a lift goes out of service. So I do know that that absolutely happens occasionally, but if it does and you're able to relay that to us, it allows us to help hold those contractors accountable. But with diversions like this, the buses will be running fairly closely together. And if there is a issue with the lift, you'll be most likely able to get a bus that's coming a few minutes behind. But again, all of the buses are accessible. If you run into an issue with any of the bus lifts, please let us know.
Well, it's, thank you for clarifying that it's only starting at 8:45 p.m. because I was under the impression a couple of months ago that the work that's going to be being done between Wellington and Oak Grove was 24 hours for the whole month of July and August. So that's why I wanted that clarification. So thank you. And I will try to make sure that I'm not taking a bus or taking the Orange Line after
Right.
8 o'clock at night.
Again, Rhoda, I mean, if you're able to just keep an eye on our website, or you can even, anybody here can sign up for a service alert for any of the modes you rely on most, and you'll get the most up-to-date information about what diversions might be coming up in your neck of the woods.
And well, thank you. And I do have the alerts that I get on the Orange Line and the Red Line, or the two lines that I mainly take. But thank you for the clarification. And it's a relief to know that it's not going to be all day, every day for a month or so.
All
So
right.
thank you.
You're welcome. Thanks, Rhoda.
Okay, next up, we have Tom Gilbert. Tom, you're muted.
Go.
There you go.
Everybody hear me okay?
Yes, we can hear
Okay.
you.
Hi, I have a question. This is in regards to the bus redesign group. I'm just wondering how much collaboration is there going to exactly be between the bus redesign group, Melissa Doulay's group, and customer experience? Because this is going to be a very, very important thing from planning this, that everybody is talking to one another, because I just got through the meeting with customer experience today at noon with Jennifer, and we bring up a lot of important things about what this in regards to bus stop spacing, the transit master being able to work properly because of bus stop spacing, what bus stops to consolidate, what to and then getting the cities and towns cooperations and making this happen. So I was just wondering if maybe if Mr. Johnson could kind of give an overview of the talks that they've been, that hopefully they're having with Melissa's group and customer experience with Logan Nash. Thanks.
Absolutely. Yep.
Hold on. Oh, there you go, Doug. You're all set.
Thank you. Yeah, first I'll say I talk to Melissa, I think, every day about bus network redesign. So there's where you could say I work for Melissa. I don't actually officially, but her and I talk every day about bus network redesign. And that's true for other departments at the T too. We constantly talk to folks in customer experience, customer technology division. They're the folks who made our website tools that allow you to, like, we have I forgot to mention this earlier, but we have a trip comparison planner. You can go on the project website and see that. You type in where you want to go to from one location to another. It will tell you what the current network looks like and then what the proposed one looks like. So we coordinate with the folks in CTD a lot. We talk to Logan Nash pretty constantly as well. The Melissa's team, the service planning team, has been pretty integral to helping figure out what the map would look like and what we'd actually be able to provide. So we've created a proposal that is within our resources in terms of bus fleet and revenue hours that we'd be able to provide. And so that team really helped figure all that out and is helping to sort of do the analysis as well to see what the potential benefits of the new network will be once we make more changes to the proposed map. So yeah, I'd say it's a pretty well integrated effort between the different divisions within the MBTA.
Because the reason why I was asking that is because so far of course SWA of course invites the plaintiffs group and Rtag of course, and Logan Nash has already invited us. It has invited us, and in the bus redesign has invited us, and but it would also be nice if Melissa herself invites us to those service planning meetings that involves the cities and towns and municipalities, because that's an important piece there too that we also need to be in the loop on, because as far as like the changes that go on in the city, especially where I live in Somerville, I knew nothing. I knew nothing of that they were changing Paulina Street to Simpson, and then the fact that J Street and Cameron Avenue have gone without bus stop signs for weeks, and the city has just allowed illegal parking there, so the stops are not accessible. This is the in cooperation we're not getting as far as the cities and towns being required. I say should be required to work with the T on the safety specifications and what they're supposed to be doing. And I just don't see a whole. I see like a lack of synergy there that's going on as far as what they supposed to be doing at the municipality end of things, and what Melissa's group and system-wide accessibility and the bus redesign team are trying very hard to make work properly. You know what I'm trying to get at?
Yeah, I absolutely hear you. Yeah, we are trying really hard to make sure that this goes as smoothly as it possibly could be in terms of implementation. Obviously, as we go through implementation, we're going to be looking at addressing any existing issues that are out there. Things that don't always go perfectly in coordination, of course, either internally or with municipal partners. But I know that everybody over here tries. Yeah.
Because
I know everybody,
because Doug, is that acceptable as far as not from you guys? And I'm not biting your head off or anybody at the meeting now. I'm saying from the municipality end of things, is that acceptable to have bus stops go for weeks and weeks with no bus stop signs, and then the city just allows illegal parking there and doesn't do their share as far as like making sure that there is no parking there, that this is a bus stop, even if they have to put up their own kind of signs indicating that it's actually a bus stop? Because Cameron Avenue and J Street are still called out on the transit master as usual, but you wouldn't know they're bus stops now because they're not taking care to make sure they'll stay bus stops. You know what I'm trying to get at? And that's far from perfect,
Yeah, I totally agree. And I don't think from our perspective that's acceptable.
No,
Um,
no.
Yeah, I don't know what's going on in a particular instance, but the coordination with municipalities, I think, is something that has been improving over time. I think a lot of it's about building relationships with the folks that work at the cities, so that we know who to call when there's issues and can, figure out how to actually address stuff as it comes up. But obviously, it takes a lot of relationship building, and that's something that we work really hard on.
Because after all, the municipalities have ordinance, the state laws, the federal law, state law, but after all, cities and towns are ordinance. So there's going to be a way of approving that what they're doing is outrightly wrong. That there's going to be some recourse of where the state could step in, or the federal or the federal government can step in. That it isn't right.
Thanks,
You know what I'm
Tom.
saying? Thanks.
Communicating with the municipalities was really, really important. Laura, do you want to jump in here?
Yeah, not on Tom's point, but actually I wanted to make a pretty significant correction to what I shared earlier. Rhoda, I owe you and everyone here an apology. I triple checked myself in the diversion between Oak Grove and Wellington. He is going to be all day long, and misread what was up there because it said it started at 8:45 the first night that it began. So big apologies about that mix up. What I would ask everybody here is that if you are out at that end of the orange line at any point between now and August, and you run into any challenges using the diversion, please let us know right away. My team will get copied on that, and we'll work to make sure that that gets resolved right away. But again, diversion is happening as we speak now, and we'll be running all summer long. Thanks.
Thanks, Laura, for the correction. I
Okay.
think we have time for one more comment before we jump into the rides presentation. So it looks like Jennifer Smith Workman, you have your hand up.
Oh.
Jennifer? Jennifer, you're muted if you're trying to speak.
Okay, can you hear me now?
There you go. You're all set. All right.
All right. Hello, everyone. I just wanted to make that comment as far as the bus stop signs to Tom. It's not the cities. I had a bus stop sign that was down literally for about 2 months, and the city has nothing really to do with that. It's just you have to stay on top of it, talking to the MBTA. Jennifer Ross, I had to reach out to her, and she was so gracious and reached out to the teams, and I finally got my sign up. It took about 3 weeks. But if you just reach out to her or someone at the MBTA in regards to the signs, even the complaint line, they will look into it.
I have reached out, Jennifer, and the thing is that I mean Jennifer's great. I mean, no complaints about you. You're right about Jennifer. She's great to work with and everything, but it's just that I feel that when it's actually, I just feel that as far as from an accessibility point of view, that the city of Somerville just dropped the ball. They just let the illegal parking go on. And, their transportation department knows that the bus stops exist, and it's just that I feel that from that side of things, they kind of dropped the ball. But you're right about about calling the T and making sure the signs are put up and everything.
Yeah, Jen is great. She's
Yeah.
great. She gets on them. If you stay on her, she stays on them. And as far as the parking, that's everywhere.
Oh yeah,
Thank-
but they just let it go by the wayside, like as if the bus stop didn't even exist. It's that bad. There's like 4 cars parked in that one bus stop. That's how bad it is.
Thanks, Tom. Thanks, Jennifer. I'm sorry. I just want to be mindful of time and make sure we have enough time for our next presentation.
All right.
But it's very important point that we need to improve communication with the MBTA needs to improve communications with municipalities. Next up, we have a presentation from the ride by Michelle Styler, the Chief Paratransit Officer. Michelle, take it away.
Hello. To describe myself, I'm a white woman in my 50s and have long, dark, curly hair. I'm wearing black glasses and a green blouse, and I'll be providing an update on the ride performance through May of 2022. Ridership continues to climb. We are 20% higher than May of 2021. We performed over 100,000 trips in May. The graph shown here displays 3 lines: a blue line that represents dedicated service provider trips at 69,663, an orange line that represents Ride Flex trips at 31,368, and a gray line that represents non-dedicated service provider integrated trips at 7,116. Next slide, please. We are beginning to see service impacts due to increased ridership combined with driver shortages. The graphs here display monthly on-time performance that has declined slightly since April, and trips that exceed 120 minutes, which have increased slightly. That would be 0.29% to 0.38% in May for the 120 minutes. And the May on-time performance was at 91%, which was a decline from April's on-time performance of 93.1%. I want to note that we continue to monitor operations and are working closely with our service providers on both recruitment and retention efforts. The driver shortage has been exacerbated by driver call-outs and FMLA leave. We have partnered with our providers to develop a new run cut, revising schedules that will allow us to put more drivers on the road to improve service. We anticipate the implementation to be late July. Next slide, please. This slide contains a graph that shows a slight decline in our hold times, or ASA, which we refer to as average speed of answer. In May, our reservation hold time was 3.3 minutes and dispatch hold time was 3.3. Oops, excuse me. I misspoke. 3 minutes and I believe 4 minutes. And I can get back to you to clarify that. We are seeing increased call volume at track and are working to increase staffing at our call center. There are a number of initiatives underway to attract and retain staff: hiring, referral bonuses, incentives to existing staff, and we're also undertaking a market equity study of wages. Next slide, please. This slide contains a graph of our complaints per 1,000 trips. May saw a slight uptick. We went from 2.55 to 3.16 per 1,000 trips. We saw a total of 243 complaints in May and received 31 commendations. For comparison's sake, May of 2021 reported 286 complaints, which is a significant improvement over May 2021, where we provided 20% less trips. Next slide, please. We provided a detailed presentation to the Rtag Subcommittee on Ride Flex on June 13th, addressing trip allotments and wave availability. We are also reviewing our online communications and will update our Ride Flex Q&As to address recurring questions. Increased wave reliability and a decreased wait time is now being reported at 17.5 minutes. And it's worth noting again, and I did last time, that we've made a modification to allow customers to opt out of Ride Flex with each trip. Next slide, please. We continue our work with the Rtag Subcommittee, meeting monthly to report on performance and collaborate on ongoing initiatives. Most recently, on May 26th, we participated in an evening listening session open to the public. A common concern was communication with the ride, drivers, and call center staff, and even from the ride out to our customers. We've also reminded our providers that we expect employees to behave courteously, professionally, and responsibly. Additionally, we intend to focus on the development of a work plan at the next session. We are reviewing how we can improve, and our new Deputy Director of Communications, Megan, has been working hard on improving our customer experience. we met with the Rtag Subcommittee on June 13th. In addition to a review of service and performance, we discussed RideFlex at great length. Next slide, please. Can we go one more? Just take a look here. Oh, okay. So it's worth noting that all ride contractors are hiring, and we want to share this with you. If you have anyone you'd like to refer, we have contact information here. Appreciate your assistance in getting the word out. Next slide, please. Lastly, key contact information. We tend to plug this in at the end of our presentation, so everyone has contact information. I'd like to just add a couple of items. The Q&A session, which I thought was wonderful, that we were able to hear from our customers and their concerns. We intend to answer every question that we identified and share that with Rtag, and I expect that to be shared by the end of next week. And I want to thank you for your patience. And that's all I have. Thank you. Does anyone have any questions? I see a lot of hands.
Yep, thanks, Michelle. So just a quick reminder again, if you have a comment or question, please use the raise hand feature located at the bottom of the screen. When you raise your hand, it'll alert me that you'd like to speak, and then we'll unmute attendees to give their comments in the order that they raise their hands. If you would like the keyboard shortcut to raise your hand is Alt-Y, and if you're on the phone, you can raise your hand by dialing *9. Okay, first up, it looks like Jennifer Smith Workman. Jennifer, was your hand up from your last question, or do you have a question on the ride?
I have a question.
All right,
I
go
have a
ahead. Sorry.
statement. Actually, Michelle, the call times after 5 o'clock, when you're trying to reach someone to find where your vehicle is, it is still over 20 minutes wait whole time.
Jennifer, we can take a look at that. We can take a look at it by time, because what I presented was the average for the day. We can certainly take a look at call times after 5 o'clock.
Okay, great. That was one of my main concerns.
Thank you. I'm just taking notes as we speak.
Thanks, Jennifer. Next up is Peter Cronus.
Hi, thank you. So Michelle, I have a couple of quick comments. First of all, on June 6th, my ride did not show up. I missed a medical appointment. And when I asked, again, it goes back to communication. One thing, the first dispatcher I spoke to, it wasn't that she was rude, but I wanted to stay on the line until she got a response from dispatch, because I had a 9:15 appointment. My ride was at 7:56. They didn't show up. I called after 8, and I was concerned because, you know, if I wasn't going to get to my appointment on time, I would have to cancel. As it turned out, I did have to cancel, because what she said is I couldn't wait on the line. Again, there was no way for me to communicate with dispatch, and I brought this up in previous meetings, that this system you've got now is horrendous and it's got to change. So I wasn't able to talk to dispatch. The person, the reservationist, refused to let me wait on the line until she got an email back. So I called up at 8:25. I finally got another reservationist. They did have a ride on the way for me by that time, but they were in another city, not far from me, but they weren't going to get to me. By the time they got to me, it would have been 20 or 9. I wasn't going to get into where I was going by time. So I did cancel the ride. And I did try to file a complaint on Tuesday of this week or Monday of this week. But your complaint on the website, it wouldn't go through. So I did send it to Rtag, and I also I sent it to Jessica and CC'd Rtag on it. So hopefully Jessica got it, but I couldn't get it to you.
Jessica shared it with me, and we have a team looking at it today, and you can expect a response. They're investigating it today. I'm sorry to hear about your trip and your experience. We will have someone get back to you. And we are still looking at dispatch, and we're hopeful that we can staff up. But we are reviewing that. We understand, we're hearing from our customers that there are problems there with communications.
Right, but you're hearing it, but, and this isn't anything against you because you're kind of new, but this has been going on for years. It isn't just one, you know, you're new stepping into the situation, but I've been bringing this up in the past, that the way this is, I've got to be able to speak to dispatch. I had to cancel my appointment. And not only that, when you have a medical appointment, and they're already real late for you, they should just pick you up and take you straight. It's not right. So I'm glad you're working on it and I appreciate it, but it's got to change.
I ask for your patience, and I understand that this is something that you've expressed concerns about before. To address this issue and to change policy requires a lot of support and work behind the scenes. But I'm hoping that we can report something out to you about actions that we're taking.
Good. And I appreciate that. Also, I have another medical appointment next Wednesday that I have to make. So I'm just hoping the same thing doesn't happen.
Okay. I saw the email today. I passed it along to the team. I asked them to investigate, and we'll be certain to have someone contact you regarding this one and regarding your future appointment.
Okay. And just one other quick thing. Are they going to do anything about making the vans bigger? What I mean by that, because I'm in a long wheelchair, you can't fit 2 wheelchairs on the van with me. And my concern is, what happens is, if they send a van with another wheelchair and I can't get on, that means it makes me late. Because what they have to do is, for some reason, they cancel the ride or they put you down as a no-show, and I'm not a no-show. So they need to address the van, the front, either take the front seats out so, you know, wheelchairs can fit in the front more, so you can fit, you know, when you have big wheelchairs, you can fit at least 2. But right now you can't, with me on there, you can't fit another chair. So I just wanted to bring that up because I think that's a very important issue.
And that you're right, and that is another recurring theme that we're hearing from our customers. And the long-term solution would be to consider that when we're procuring new vehicles. We need to take a look at how to address this. And I did have, and I think you may have been at the last meeting when that I had them pull some data for us to look at, and we are reviewing the data. So we are taking some action.
Great, I appreciate that. I appreciate you listening. Thank you.
Thank you, Peter.
And thanks for your presentation.
You're welcome.
Thank you, Jessica.
Thank you as always, Peter. And you know where to find me so we can follow up on this easily. All right. Next up, we have Tom Gilbert.
Okay. Hello, Tom.
Hi, hey, Michelle. I just wanted to comment that I thought it was a really great presentation you gave, that you given, and it's probably maybe a little it's probably a bit delayed, but you know, welcome aboard, and it seemed like I'm really impressed. You seem to really know what you're doing and everything, and but I know from Jennifer and from what Peter just said that there's a lot of things we have to, you know, that we have to rectify as well and everything, but thanks for the great presentation and your professionalism.
Thank you, Tom. And I have to say that I'm only as good as the team that props me up. They do all the work. So thank you to all of my team members that are here on the call and that support us every day.
Yeah, that's good. That's a good thing there. Hey, I was just wondering, just a real quick question. What Peter was mentioning about the vans not being big enough, uh, the vans that he runs into trouble with, are those the vans from Shepherd's Brothers from upstate New York, or is that a different company? Because I thought when they worked with Shepherd's Brothers, they had solved that problem years ago. But then when they ordered the new vans, it seemed to have crept up as a new problem that they couldn't get into the vans. Would you know have any?
I would actually, I couldn't speak directly to that. I was looking to see if I have a team member
Can
on.
I clarify that?
Okay, Peter.
It's Peter. Hi,
Yeah.
Tom.
Hi.
Let me just clarify.
Just hold on a second. Let's spotlight you.
Okay.
All
I'm
right, you're all
sorry.
set. You're all set.
Okay, so I can't sit up, Tom, so I'm in a prone position.
Yeah.
And in the old vans, the front seats used to go up, but on the new vans, they have these fixed seats. So I can't go as far in the front as I used to. So I'm more towards the back of the van where the lift is. I can't fit on there with a second wheelchair. But if that chair was missed, in other words, if they remove the two front seats, like they have on the older vans, then I could move to the front and you could easily fit a second wheelchair behind me if you had to.
Oh, I see. So it sounded like with these so-called newer vans, like if it ain't broken, don't fix it. It seemed like they made the problem worse when they ordered the new vans, because it seemed you could do that with the older vans, right? With the older Shepherd's Brothers vans.
Piggybacking off of that,
Yeah.
they should be giving you the vans that they keep giving me in the mornings.
Mm.
That's what I'm
You
seeing.
guys, everyone, I know that everyone's helping each other out, but just for our interpreters, we have to speak one person at a time, and
Okay.
just to make sure we have clear interpreters and audio for them.
So again, I just wanted
Peter?
to, I'm sorry. I just
No, go
wanted to
ahead, Peter.
finish. I just wanted to finish by saying it's not the size of the van. I can get into the van. I just can't get to the front.
Right.
But you're saying with the older vans, you were able to do that, but not with the newer vans, right?
Yeah, but it wasn't the size. It was the fact that there were no seats blocking my way.
No, oh, no
Michelle,
seats.
I know
Okay.
you've been doing a
Thanks.
lot of work into this issue, and I know it's been brought up at many meetings, not just by Peter. Are you able to respond to this?
I do not have those stats in front of me, but I can tell you some of what we looked at were how many non-ambulatory passengers we have, how many trips we have where we transport two wheelchairs or wheeled mobility devices at the same time. And we're digging into that data just a little bit more. I do have that data. I unfortunately don't have it here in front of me. But we're looking to capture it, to drill down into the issue. And Peter, I certainly hear you about the challenges with respect to the vehicle and that your transport can only occur with one wheelchair. Yes.
Yeah.
Can I make a suggestion?
I'm sorry, hold on one second, just so we have clear interpreters. Michelle, I know that this is an issue that we've been continuing to discuss with the RIDE subcommittee, and that you are working to try and figure out a solution.
A short-term solution. We know long-term it's the vehicles that we procure, but short-term we're drilling down into that data. I'm sorry that it isn't an immediate solution, but we are looking at it, and we can speak to Rtag with additional information at the next meeting.
Great, thank you. Kimberly, I know you tried to jump in there. Do you want to ask your question now?
Yeah,
Thank
can
you
I
for
make
being
a
patient.
suggestion?
Yep, go ahead.
When you're dispatching and when you're reserving the rides, how about asking the customers, what type of car do you need to pick you up? Literally.
We don't allow the customers to select their vehicles.
It might help.
The mobility device would determine the vehicle, but we don't have the, I don't want to say leisure, but we are not able to accommodate specific requests for vehicles unless it's accessibility related.
Well, that's accessibility right there, because hey, I'm getting the vehicle that's needed, the type of vehicle that's needed for somebody else who is in the wheelchair. for an
We are
example.
presently, we are deploying the vehicles as best we can based on need. And with respect to the larger wheelchairs, that's something we're looking at. But right now we're deploying the vehicles and dispatching the vehicles as best we can with the software that we have.
Thanks, Michelle. Kimberly, did you have a question as well?
Speaking about the software, and when you had the old software, we was able to order online and put in different addresses, and still haven't been able to change that software. You guys said you were gonna do that when you first changed the software back.
Well, there are two things that happened. One of them was that we struggled with route match and we had to revert back to an older version of Adapt. We have an older version of Adapt that allowed us to stabilize our service. And we're in a position now where we're doing requests for information, RFI process for new software providers with upgraded software to speak and present to us. So we're exploring what software can offer additional tools and amenities to our customers. But we don't anticipate transitioning to another new software for close to 2 years. It will be a long, protracted, thorough research.
Yeah, 'cause I want to be able to do it online instead of sitting on the phone for 2 hours.
Michelle, if I may,
Sure.
the online portion does work. You're just not able to freeform your addresses. If you contact the reservationist, they'd be happy to assist you and put predetermined addresses in your profile for you. That would allow you to book online in the future.
And just for those that may not have been able to identify it, that was Mike Kulak from the Office of Transportation Access.
Thank you,
Mike.
Jessica. I'm a mid-40s individual, blonde and grumpy. Thank you.
Same, yeah, mid-40s, blonde, and thin-figured. Sorry.
Not
I forgot to
grumpy?
so I just forgot to describe myself, sorry. And background with my other half.
Thanks, Kimberly. Next, we have Debbie Weathers. Debbie, are you still there?
Oh,
There you
okay,
are.
I'm here.
Hi, thanks.
Trying to unmute it. Kept disappearing off the screen. I have a couple of questions. Okay, first of all, I understand, you know, when you answer the phone, they say we may either send you a flex or a ride vehicle. Okay, I had a problem the other day, and I still have this problem with it a lot. They like to drop you off way too early for your appointment. Well, this particular day, they dropped me off an hour and 10 minutes early for my appointment. No one was there, so the doctor took me. So now I got 2 hours to wait to go home because it hasn't even been to the time when they're supposed to drop me off. So I called to see if they could, you know, rearrange the time so I can go back home, seeing they dropped me off an hour and 10 minutes early. So she proceeded to say that, oh, we can't do that because you asked to be off, to be picked up at a certain time. I said, yeah, but I asked to be here an hour and 10 minutes early. I had no idea the doctor was going to take me because she didn't have any other patients. So she proceeded to say, well, we can't do that. I said, well, I got flex. According to flex, you can send me one or the other. What's wrong? I can't take a flex. Well, we can't use it that way. Am I to understand that they can only use the flex vehicle to suit their purpose? I didn't see anything wrong with them switching that around for me. I didn't need to sit there 2 hours. And then they turned around and told me I had to wait for the time that I had to be picked up. And then the vehicle that was supposed to pick me up was 45 minutes late. So I spent a total of 3.5 hours overtime there when they could, all they had to do was send me a flex vehicle. I don't understand how it works one way and not the other, because as people have been pointing out to you, we've been stuck one way or the other plenty of times. It seems that when we ask one time for them to do something, I don't understand why they can't do it.
Okay. So your question is, if your trip is running late, you would like to be able to request your trip go to Flex?
Well, I
Like
have
an integrated program.
I'm in a flex program. They can send me one vehicle or the other. They
Right.
dropped me an hour and 10 minutes early. Okay?
Was
I
this a
had no
ride vehicle
idea.
or?
This was a ride vehicle. This was a ride vehicle that dropped me off. I had no idea that the doctor was going to take me because somebody else didn't show up. Okay.
Okay, so the ride
So by
flex
the
was,
time they took me, go ahead.
no, I was going to say the ride flex was created to provide additional support where the providers need, and the providers were to parse out additional trips.
Okay, that to me is support. They messed me up that day. Therefore, I had to stay longer than I needed to be there. Instead of being there for the 2 hours that I was, they helped me off another hour early. I asked to be picked up. You know, they can do that. They got a flex vehicle. If they can switch it one way, they ought to be able to switch it the other way. I don't understand why it works in their favor all the time. No matter what happens, if they drop me off an hour early, 2 hours early, I've been dropped off 2 hours early before too and had to wait around. Okay. But
well, oh, so the first
to us, you think one time you asked them, they could do it for you.
So I'm hearing two things. I'm hearing frustration with being picked up and dropped off early, and that was a ride trip. So what we can do is gather your information, and we can investigate why that occurred and how that occurred. Then the second part of the trip is you'd like to
they sent me back a thing, which I totally disagree with what they said on it.
They did respond. You submitted a complaint.
They responded to me, but I I totally disagree with what they said, because they say the same thing all the time. The generic, the thing information they give you, they're all generic. Oh yes, they did drop you off this early, but you asked to come back this early. I didn't ask to get there that early.
Okay.
Debbie and Michelle, maybe
we can Debbie, we can
make a suggestion, Michelle.
We can gather.
It sounds like this is a quite complicated situation. And so Debbie, maybe it would be best if Michelle and her team reach out to you individually and follow up with you offline about this.
Okay, but I have a problem with that also.
Well, Debbie, I have your information.
I know, but I have one other thing that they need to hear.
Okay,
go ahead.
Since COVID, and we're back to being able to get on the buses, I have talked so many times trying to get a supervisor to call me back. They never call you back. I've had so many issues. I sent in reports and everything. I never got a response. Every time I talk to the T people, they tell me there'll definitely be a supervisor call you. I never get called back. I used to get called back before COVID, but they don't call back anymore. These problems with these drivers and their groceries all over the front seats and stuff. I sent that in so many times. They keep telling me, report it. I'll definitely send it to you. I never get answers for them.
Debbie, we will have somebody contact you tomorrow. We will have somebody contact you tomorrow. We will ensure that I was going to say we fully understand what your complaint is, because it sounds like there are several issues, and we'll have someone follow up, capture them, and then follow up with you.
Okay, I'm gonna look for the call. If I don't
you will get a phone call tomorrow, even if it's from me.
Okay. All right, you got my phone number?
Debbie, are you able
we
to
have you on file, right?
Okay. All right. Just saying, because this is the first time I've ever been able to get through.
Thanks, Debbie. And so, as Michelle said, Michelle or someone from her team will contact you tomorrow. And if you don't hear from them, you can feel free to email me at rtag at mbta or rtag at, sorry, I'm reading multiple emails popping up, rtag at bostoncil.org, and I will forward your information to them. Okay, so do we have any other questions on our ride presentation? I knew we would have a few more. Jennifer Smith-Workman.
I knew. Can you hear me?
We can hear you. Thanks, Jennifer.
Oh, okay. I think what Debbie is pretty much trying to ask is why, if you guys are able to send somebody a Uber on the Ride Flex program when they want a ride van car, whatever, if you're able to send them the Uber instead of the van, why is it not the other way around in a case of a mess up on your part? I'd like to know the answer to this too. Where is it and why is it not where dispatch can say, okay, we're gonna take that driver, since he's running late already, and send him elsewhere and send an Uber or a Lyft to pick someone else up, because we know that she's gonna be extremely late being picked up, since we did drop her off extremely early. That is pretty much what she is trying to ask. Why is it, and where could we go from there trying to implement something like this?
There are two different options. One is enrolling in the integrated program, which is when Track will shift a trip to Uber or Flex, Uber or Lyft. And that is done at Track's discretion. And that is done, they have a limited number of trips that they can shift during the day. And it's done at their discretion. And it's done to relieve peak periods when there are challenges. There is also the on-demand option. And we're going to spend a lot of time on this. Well, I'm just thinking, we are updating our frequently asked questions online because there are a lot of questions with regard to Ride Flex.
Yes.
But there are two different options. And what we can do is share that information with you. We're working on a cheat sheet regarding how it operates. But one of them is where you book directly with the non-dedicated service provider on demand, and you get the limited number of trips. And the alternative is that Track will shift trips from our dedicated service providers to our non-dedicated service providers. And we're unable to do that upon request. So perhaps we can speak with you about the on-demand option.
No, I think we all know how the on-demand works
Okay.
and things like that. We were just wondering if it is able to be switched at their discretion to send for a trip to go, a Uber or a Lyft. Why couldn't they use their discretion to help someone else out to get home?
I understand your ask, and I can tell you that they have limited number of trips that they can shift.
Okay.
And it's also being mindful of costs.
Right. Okay. All right.
But we can share additional information. We can share additional information, yeah.
Michelle, I'm wondering also, could someone get a call back if the driver's running extremely late and you can't, and since they've dropped you off early, could you get the option of saying, oh, no, never mind, because you already said there's a limited, because since we are in the Flex program, we would not want to have to use our number of rides to come back.
I understand what you're saying, yeah.
You know what I'm trying to say.
Yes, and you know what? I know that we're chewing up time here. I could absolutely have a team member get back to you if you looking for further clarification.
We'll work on it at the next meeting.
Okay, and we are working on, like I said, we're working on updated frequently asked questions and a fact sheet, like a cheat sheet about it, so people understand it more, because there are a lot of questions regarding it.
I think if
I know what she's asking.
I do too.
Make sure people understand that ride only has limited amount. And I mean, you have so many selfish people. I don't care what the ride has. I'm just worried about me. But it needs to be clear that the ride cannot switch over to the Uber, bringing you back on your request, since they screwed up, you know.
She's saying, okay, I know what she's saying. Can I elaborate some more what she's saying?
I'm
She's
sorry,
saying,
I can't identify
because the ride is late.
I'm sorry.
she's
For
asking-
our interpreters cannot interpret multiple people at once.
I know, but can I
Who's
speak
trying,
on her
who's trying
behalf?
to,
I know
I
what she's
understand you're trying to
asking.
help. Who's trying to jump in so that we
This is
can
Kimberly
identify
Fall,
you?
blind, thin figured,
No,
with somebody on the background in my picture. And what she's asking is when the ride is late and if you use a flex, she wants to know if it could be under her ride account instead of her flex account is what she's asking
I understood what
when
she
you
was
send an
asking.
Uber.
Thank you, Kimberly. I understood what she was asking, and I explained that no, it can't automatically be shifted. That there are a limited number of trips, and it's the discretion of track to shift those trips. And they do shift them to relieve trips that are suffering. They do.
Correct. Thank you. Thank you.
all
We'll
right.
speak later.
I want to make sure we have enough time for our remaining questions. Thanks, Jennifer. Kobina Bonnie.
Hi, I actually raised my hand because I wanted to make a comment about this very issue. I've heard Michelle's responses, and for some reason, it makes me wonder. Yes, there's the use of discretion, and oftentimes that basically allows you to be able to troubleshoot, solve problems as they come up. So there's sort of resort to saying they use discretion to relieve congestion, etc. That seems to be a very narrow range of uses for the discretion. In this example that we're talking about here with Debbie, I would think the average person would want to solve the problem. And if so, then they ought to be able to use their discretion to fix it. Okay. Yes, I know there are rules, etc. So I would beg to suggest that you guys seriously think about what are the situations you would allow the use of discretion rather than simply limited to when there are, systemic issues, you want to relieve pressure, and therefore you use discretion in that situation, because this issue here can be solved by someone choosing to use their discretion to deal with it, and then hopefully it doesn't happen again. So that's my comment. Thank you.
Thank you.
Thank you very much for your comment. So it looks like we are wrapping up at time. Thank you very much. And it doesn't look like we have any other hands raised for questions. Thank you everyone for your feedback, comments, questions, and concerns that you've raised today. And we look forward to seeing you at our next general meeting, which will be in August. I hope you all have a wonderful holiday weekend, and thank you very much.
Thanks.
Happy holiday.
Happy holiday. Thank you, everyone.
Bye-bye.
Can I jump in 1 minute? When in August is it?
It's the last Thursday of every month.
Oh, okay. Thank you. That's good to know.
You're welcome.
Thank you so much.
Or
Have a wonderful
I'm
day.
sorry, every other month. That's an important clarification.
That's your 5th time you made that mistake.
I know.
Thank you,
Sorry,
hon.
guys.
That's okay. We sometimes have those that, whoops.
Next Monday.
Thank you. Have a good day.
Thank you,
Yeah, have a good
everyone.
day. Thanks. Bye-bye.